Good morning. Thank you all so much for coming today. This is my welcome to the Liberty's Kitchen, and the Taylor Center is sponsoring this breakfast. I'm so happy. This is my first time hosting our new design dialogues, and today is the first day that we've had it as design dialogues, rather than the previously and most known design thinking breakfast. Breakfast will stay, and hopefully soon with the conversation. Glad that breakfast is a hit today. Today we have a special guest, Kwame Tara, and I met him actually at the last one when Ray was presenting, and I already know and trust whatever he shares today is going to be amazing, just because of like the strength and power and also humility that I saw and experienced at the table, while he just like said a little bit about his work, didn't have to say all the backgrounds, like, also I made this work. They're just like real casual, oh, you know, no, I made it. And I just thought that was really beautiful, and I think that his work will speak for itself. It does, even on the website. But just a preview about some of the things on the internet about Kwame. He has a MPH for public health, and he is the founder and CEO of bEHR Health Systems, and an app that also is, from what I understand, you get to do a health score scan of your body from your phone. And I think that that's really excellent work to do, especially in the New Orleans community, because historically and currently, it can be very challenging to trust our healthcare system. And a lot of times, even from my own experience, misdiagnosis happens all the time. People don't listen when, especially Black and brown people, say they're in pain or tell them what it is. And I think that from what I understand so far about Kwame's work, it's wonderful because it gives the tools to the people, and they can therefore have connections to public health professionals that they can trust and get to know, because it's connected to a source and a tool that they can trust on their own individually, and all that. So thank you so much. If you guys can please give a warm welcome to our presenter today, Kwame.
Good morning. Morning. How are you guys doing today?
Good.
So before I get into the presentation, I'm going to say a little bit more about myself, but I want to speak a little to design thinking. Who here knows what design thinking is? Everybody have a pretty solid definition of it? We're going to do an exercise that kind of exemplifies design thinking. I've spent the past year doing what are called startup incubators and accelerators, which are essentially rooted in the idea of design thinking. Most of us, when we think about coming up with a business idea or a solution to solve a problem, we come up with the idea first, right? We have this really cool technology, or we have this really cool idea that we may have thought of, right? And then we just want to put it out into the world and hope that people like it. That doesn't usually work, right? The better approach is to just go and observe people, right? Find out what problems they currently are dealing with, and then build a solution kind of reverse from there, as opposed to just throwing something after. So to start off, I want to do an exercise, and I want to know why you guys came here today. And so I think there's some notes that you can write on.
I put on my notepad to learn more about design thinking as it pertains to healthcare.
Why do you want to learn more about design thinking as it pertains to healthcare? And why do you think, why is it important to you that we use design thinking, even based on what you know now, to solve Black health problems or disability problems?
Because one of the things that I learned in the first meeting I went to with design thinking is basically, as the professionals, all we are facilitators. And it's important, especially, like in general, it's important to get the community or the people that's actually dealing with the issues. Their viewpoint is the most important.
Why is their viewpoint the most important?
Because they know exactly what they need and what they're, or maybe not what they need, but what they're going through.
And why do you need to know what they're going through to solve problems?
I guess they're the most important. Like, okay, so You are, I guess, you are the narrator, should be the narrator of your own story. And therefore, we can't go and assume that we know what someone else needs if it's not our story. Even if we dealing with like kind of the same issues, the story's not going to be the same, because different lifestyles, different things, they're all going to be different. So with that being said, I guess, what was the question again?
Why is it important to focus on their...
Yeah, because they know exactly kind of like what they're dealing with and going through. They're the narrators of their own stories. We can't just go in or we shouldn't. I mean, we can because it's been done in the past, but we shouldn't go in and just assume we know what's right for everyone because we're quote unquote the person.
Right. People have done that, and we technically can try that. But you're saying we should do design thinking. We should incorporate people into the design process, ultimately because why?
We can't. I guess the decision making, we shouldn't be just going on what we think or what we know or what the literature says when implementing or trying to create different programs or whatever it may be for people.
I'm gonna stop picking on you, but so
Okay.
give her a round of applause. What I got.
I haven't even had coffee.
We're gonna do one more.
Stood up to it.
Yeah.
We're gonna do one more, but what I got from that is that she came here to find out what the real problem is. Right? That's her why. Right? Maybe she came here because she's interested in design thinking, interested in this, that, and the other, but she came here to find out what the real problems are. Right? Because something with what we presented here at bEHR suggests that we might have an idea of what those might be. Let's do one more.
I also come from an MPH background,
Okay.
so I'm passionate about public health. I'm interested in power dynamics, equity in healthcare, and anti-racism in healthcare. And I'm also transplanted to New Orleans, and so I want to know as much as possible about my community and the people that I'm serving in public health.
Why do you want to know as much as you can about your community?
Yeah, so kind of along the same lines as what I heard Alicia say, of like being able to define a problem. You can't just define a problem for somebody else. And something that has drawn me to design thinking is that in public health, the power is all with practitioners, and there isn't a lot of the avenues that are used in public health are not actually community friendly in a lot of the cases, and especially learning at Tulane. And so design thinking has offered me a lot of different ways to interact with communities and to actually center people in the program development, in policy, research, and all of these aspects of public health that are like can actually make differences instead of just reinforcing the current power structure.
So maybe you came here today to learn how you can push up against the current
Absolutely.
power
I'm always
structure,
trying to do
right?
that.
So that's the idea, right? There are these functional or technical reasons why people might come to an event or use a product or service, right? But then there's like the real core emotional why. That's what you actually want to know when you're designing products and solutions. That's what you need a market to, right? Is those emotional drivers. And so we've done this with our users. And then after I explain this, I'll go into our product. But again, it started off kind of like with a functional why. Why did you download our app? So that I can know my health score. Why did you download our app? Because I want holistic evaluations. All these things are great. But ultimately, once we got into it, we got to more, deeper emotional reasons why. For the betterment of the world. Right? That's not something that I would assume someone downloaded my app for. But now I know that it is. To reduce suffering in the Black community. That's deep. Right? When you think about solving the problem, it's not just about helping people become more aware of their health. It's about reducing suffering in the Black community fundamentally. And then even simple things like my health score just makes me feel good. Right? That's something that someone learned over time as they started using the app. They check it every day just to see it go up or not, right? little more background on the problem that we're trying to solve. So in the US, Black people are aging faster and ultimately dying earlier as a consequence of all things that we're all aware of, right? Take New Orleans, for example, where you can find disparities in life expectancy as great as 26 years, such as between Lakeview and Tremaine. Right? That's 26 years without family, that's 26 years missed opportunity financially. I mean, think about if you had some money sitting in a bank for 26 years that you could pass to your family. These are the things that we don't think about as it relates to health disparities, but have a significant impact. Okay? Again, we know what's driving this: poor social and environmental conditions, poor lifestyle habits, underutilization of healthcare, and most notably low health literacy, which is the problem that we're going to be focusing on in our company. Right, 60% of Black Americans have low health literacy. Most of us don't know how to live optimally healthy lives. That was by design, but it's a problem that can be solved, right? So that's ultimately our vision here at bEHR. At least that's what we're starting with in this first tool. Our goal is to predict, prevent, and reverse the chronic conditions that plague our community. Because fortunately, they are predictable, preventable, and in many cases reversible if you intervene early on. However, our current healthcare system, though it's equipped, it is not really designed, right, to heal Black people. It never involved us in the process, right? In fact, there were very intentional policy practices and beliefs that had caused these problems, and that's why I also think that the solutions should be just as tailored, just as targeted. So that's our vision at bEHR, right? To build a healthcare resource that's free from the shackles of racism that infect our current system and seamlessly integrate health into Black culture. And so it starts with our app. Yep.
What does bEHR stand for?
It stands for Black Electronic Health Records.
Thank you.
Okay, so raise your hand if you know your credit score. Yeah, I'm not going to ask you for your credit score.
I have to be careful with you.
And now raise your hand if you know your health score. One person. That's a problem. We got to work on that, yo. Don't worry, we're going to work on it a little bit. All right, so our health score provides people with a real-time, comprehensive assessment of their overall health and well-being. Right? The power is really that it helps people identify health risks early on. Right? Again, most of us don't know how bad we're doing. That's really what inspired this. During the COVID-19 pandemic, it's like, do we know how bad we're doing and what the short and long-term implications of our current health status are? I asked around, I asked my mom about it, she said, yeah, everybody knows, we just don't care. And turns out, according to data, we just fundamentally don't know. And as we've started to share the health score with our community, that turns out to be the case. So that's really what it's about. Cool thing about the app is that it's not just a snapshot assessment of your health score, right? If you go on a run one day, score goes up a few points. If you get 3 hours of sleep one night, your score goes down, right? And it's a metric that can help people understand and evaluate their health in real time. So when someone first downloads the app, they complete an initial health score assessment, right? So you answer some questions about your smoking and drinking habits, eating habits, so on and so forth. You connect a preferred health tracker if you have one, though it's not necessary. And then you get your health score, right? This person's score is 448, which is considered low on our scale. Your health score will be a number between 0 and 1,000. Anything below 550 is considered fair or poor. And when we start to really communicate messages about potential risks that you might be associated or that you might have. All right? Now, what happens from here? Based on those changes, they'll start to receive personalized messaging from our AI coach. These can be messages such as, at first, just communicating current health status. Hey, based on your current health score, you may be at risk for this condition, or you may develop this condition by this age. Here's what you can do to reverse it or prevent it entirely, right? Or simple things like, hey, just checking in, did you make sure that you drink your water today, right? Just different messages based on what your health score is, right? So we get tracked over 7 different categories. So mental health, physical health, nutrition, what else? Sorry, sleep. Sleep for sure. My sleep score is under 400 right now, so that is that. And as well as self-control, so like substance use, things like that, mindfulness as well. You get a score in each category. So while your overall score may be good, right, you may be doing well overall, you may have low in others categories, and so the messaging that you receive will be tailored to where you need the most So yeah.
What inspired you to have like the wellness aspects of mindfulness in there as well?
Oh, I mean, because it's a part of health.
Yeah.
Yeah.
I agree with that. But like,
Yeah.
across the board, I think that's pretty unique.
Yeah. I mean, I think across the board in American healthcare is that they focus on 10% of the problem.
Yeah.
Right. So 10% of the problem, for those who don't know, is driven by health, like the clinic. Right. People spending time in the clinic, going to the doctor, things like that. That accounts for 10% of healthcare outcomes. The rest is driven by environment, lifestyle, maybe 10 or so percent genetics.
So people have this information, but how do they then access actual care? And that would be thinking about, say, if you can get Medicare in this state, is there a doctor who will actually take the Medicare? And so that's, I think access has got to be one of the major concerns also, so people have the information, which might raise their anxiety level, but they can't do anything about it.
Right. Well, that's a good question, and it's actually the next step, right? So based on, if the health score education isn't enough and the health coach education isn't enough, you can find a healthcare provider or resource on bEHR Connect. And this is the part of the platform that we're working on right now, which is helping people connect with care. Once they know, how do we get them to care? Because you have to know what's going on the inside to really understand how your overall health currently is. Yeah. So these can look like simple resources, free resources that people can access. For example, Wellness Wednesdays at Dreamhouse, where people can go in and have conversations about their mental well-being. It's a free resource, right? We really want to design a product and a solution and help people understand health as affordably as possible, right? I'm fundamentally a minimalist. I spend very little money on every aspect of my life, but I found a way to be as healthy as possible or as affordable as possible. We're going to incorporate all of those concepts into our health platform, and specifically as it relates to health. I mean, physical health. We will offer free health screenings, so mental health mental health evaluations, blood pressure screenings, glucose, things that are very simple. And this is information that also goes into the app to help people at least get a baseline for how they're doing. Okay. Yep.
I'm just curious, so it sounds like you're working on the part of it that's connecting people to a healthcare provider. I'm also wondering if there's a part of the platform where healthcare providers can then access information about their clients.
Yeah.
Yeah.
It's almost like we all scripted this together. Right. So what I just explained was real-time health education for individuals. Right. On the back end, we work with health stakeholders where they can use our data to help evaluate and improve interventions that they roll out, as well as evaluate those in real time and make modifications in real time. And that's really the value. When it comes to most, health equity solutions, right? We'll go do an assessment, maybe do some survey data, make a plan that lasts 3 years, and go see how that plan went. So much has changed in 3 years in people's lives. Things change in people's lives on a daily basis. And so what this enables is we roll out an intervention, a health promotion programming, or we roll out a new policy, right? We can start to see how that's affecting people's walking habits, right, in real time. We can say, hey, maybe we need to modify this aspect of the policy because it's not working, right? Or it's actually causing more problems. But we don't usually know that until years later, right? And that's really what the power of this is. No question?
Yeah. We might get to this later,
Yeah.
but I'm wondering how, coming back to that design thinking concept, how your own conception of bEHR health and where the value is has changed over time as you've gathered input from early users and things like that. Maybe you'll get to that. So
Yeah. Jumped ahead of us there.
I can wait.
Yep. So here's our team. Includes myself, Dr. Brianna Sims, Taylor Smith, and Taylor Allen. We all have a variety of experience in health education, grant writing, business development, and health technology and more. Taylor Smith is actually graduating from medical school this May. So, and then a large part of our work is conducted by our student interns. We are notorious for having 50, not 50. We had 50 at one point. 30 student interns. So fundamentally, as an entrepreneur at this stage, early stage, my goal is to get a lot of people to do a little bit.
Yeah.
Right? I don't want to burden people too much. We're not in a position where we can really pay people. But, you know, maybe you're excited to be a part of something, want some free merch, and, you know, I can get you to come to a community event once a month, right? Or post on social media one day. But they're incredible. They believe in what we're doing. They love the aspect of the mission, and they like engaging with people and talking to them about their health scores. And so now let's get into how we got here, right?
My main goal is to be consistent and working out, because I'm always good at that when I'm at college, because it's easy to get to the weight room. When I go back home, it can be tricky getting to the gym. So what'll happen is I'll work out here, but I won't work out at home. And it's that up and down that's probably keeping me from getting the body that I want. So I want to exercise.
Okay. Did everybody hear that? Clearly, okay. So he's working out. He's doing well when he's at school, but when he goes home, he's struggling. There's no way we would have known that had we not sat down and talked to him. Right? There's no way we would have been able to incorporate that into our platform and been solving that problem for him. Right? That's the problem he has. Not he wants to know his health score. That may be cool to him, but he really just wants to figure out how to stay consistent in the gym when he's not at school. Right? What you just saw was a clip from one of our community design sessions. So our community design sessions are essentially community-based participatory research sessions where we invite the Black community in as equal partners in the design and development of our products and services. Black people have had little to none no involvement in the development of mobile health solutions. It's part of why they don't work as well for us, right? And so we're taking that problem straight on and inviting them in, right? This leads to a greater sense of trust, engagement, and ultimately a sustainable solution that people benefit from. So this is how we do it. We host a community design session, whether that's at a university, we go to a healthcare resource fair, and we essentially do these large-scale customer discovery interviews, fundamentally driven by the health score assessment interview. So someone will come to our table, we'll ask them a series of questions that get their health score, then we'll have a conversation about it. Why do you think your health score is what it is? A really important question is, what are you currently doing to solve that problem that's not working for you? But that's a really important question to ask you, because we can identify that there's a problem, but like, why is that problem still existing and persisting despite the fact that you have access to unlimited information on the internet, right? That's where we can really find out how to help people. One additional piece that we're starting to incorporate now, because again, we're building a healthcare resource. We're starting with a mobile health app, but we're ultimately building a healthcare resource for the Black community. So one thing that we start to ask now is, what does ideal healthcare look like for you from here? You now know how you're doing, you have your health score, but what's the next step? How do you want to connect with healthcare providers? Do you want it to be remote for the most part to start? Maybe, right? Those are the things that we're starting to understand, and we're not going to make any assumptions about what those are. Based on the insights that we gather from those health score assessments and those conversations, both quantitative and qualitative, we'll work with community partners to roll out the solution, right? That's key, trust, right? And what's also interesting and cool is that we can create community level customization. So there are 70 plus neighborhoods in New Orleans. We can create a unique access code for each neighborhood. Each neighborhood will have maybe slightly different messaging, right? Some neighborhoods, for example, may never go to Popeyes, right? And understand our question that says, how many servings of fried food do you have per week? So some people that may be an easy question to answer. To others, maybe don't have a point of reference for what 2 servings of fried food is, but they do know what a 2-piece at Popeyes is, right? So we put that in the quotes in that community segment. And that's really where the community level customization comes in and can be powerful. So we did over 1,400 of these health score assessment interviews last year. We were working against students, right? I could not have done that without all of the students that we were working with last year. 10 plus community design sessions, fundamentally here in New Orleans. Maybe 100 plus for them were outside of New Orleans, but for the most part they were here in the city. Okay, currently have 260 users. Again, most of them are here. And what we've seen so far is that when people know their health score and how it compares to others in particular, it's a strong motivator for lifestyle change and engaging with healthcare resources. One of our students had a really low health score compared to a couple of the other students on the team. And We had a blood pressure cuff in the office all semester. Just been sitting there. Now I used it regularly, but they all think they're still learning that what it means to prioritize health, even though they're part of the company. The next 3 days, this young lady came in and checked her blood pressure. Because what she did know is that if I put some information in the app, my health score might go up. That might not even have anything to do with health, but she wants her health score to go up, right? And that was an interesting learning, but something that if we can really tap into and hone and scale in the Black community, we can, again, get a lot more people engaged with preventative healthcare services. And things like blood pressure machines, again, glucose monitors, those are affordable, accessible tools that have a lot of valuable insights for people as it relates to their health. Some of the things that they mentioned, again, it's nice to put a number to their health, right? That simplifies it for us. Health is vague and complex, and there's all these different numbers for each aspect of your health. It's like, hey, what's my health score? Like, how am I really doing? And that's what it's able to do. Some people say they're making better decisions. /quiz. Complete your health score assessment. This is just a snapshot. This isn't the app, but it'll give you an idea. By no means is it entirely comprehensive. The more information that is put into the health score algorithm, the more precise it will be. And it typically needs some health data like blood pressure, blood sugar, stuff like that. But we're just not going to take that on the website. It's what to do with the HIPAA stuff. We'll do that part. Yeah.
There's the mismatch between looking at the sort of mortality and morbidity data where Black folks often say, for example, breast cancer, not diagnosed as often but a higher mortality rate because folks don't have a chance to go and get diagnosed. So are you seeing potential to close that gap?
Well, I mean, 100%, but fundamentally, again, our company is about early detection. And while Black people do have less access to healthcare, on the whole, most people have access to healthcare. 90% of people have health insurance, right, in this country. And so the access piece that we really have to work on is right here, right?
To go.
Yeah, to go. To know to go, right? Healthcare clinics are available. You know, even if you don't have, even if you're not doing well financially, there's still resources that you can tap into. It's just the knowing that you should go, right? When it comes to cancer, any cancer, early detection is our best shot. Early detection is our best shot, because that, you know, we can nip it when it hasn't reached a certain stage. And again, that's really fundamentally what our platform is about. We want to help a 25-year-old know that they're at risk for type 2 diabetes by 30, so that they don't develop it. Because our bodies can only live with these conditions for so long, right? Before they take us out, and that's essentially what's driving the problems and the disparities in the Black community. We're just aging faster, right? Although we're maybe 54 years old chronologically, on the inside we're 75. And that we are going to work with them on, as it relates to the health score algorithm in particular, is the accuracy as it relates to the Black community, right? The health score is based on 300 million person years of clinical data.
Okay.
Pretty robust, right? But Black people aren't in that data.
Right.
So when a Black person gets their health score, right? Let's say it's 575. Okay, cool. Well, their score actually might be a little lower than that, because generally we, again, like I said, have worse outcomes for the same conditions. Right, so as we bring more Black data into the health score algorithm, we'll be able to refine it, and so that's where their health development will also be a factor in the health score.
Thank you.
So with the algorithm, like, I know that you said it's neighborhood specific, but do you take into account like the food desert situation in that neighborhood when you're calculating the score? Like, how does the algorithm take all of that like environmental aspects into.
So it doesn't yet.
Okay.
Right? It's strictly based on lifestyle and health data.
Okay.
Those are things that will start to emerge as we see differences within communities.
Yeah.
Right? And as we add to our own aspects to the health score algorithm with the company, then we'll be able to identify specific things like that. And then that's really where we hit the policy. Because ultimately that's what this comes down to. That's how you solve the problem.
Yeah.
Yeah. But we need that strong data.
Have you like encountered any people at Xavier who are like in the tech world and now are wanting to move into the public health world? Because I feel like that's something that I try to do is pull everybody into public health. We're like, yeah, bring all your skills.
Yeah, I mean, so we have a computer science department at Xavier, and we're a tech company, so that gets their attention. We've worked with 3 computer science students. They're early in their coding years, if you will, so there's not much they can do for the app or for the algorithm at this stage, because they're just not learning. Now maybe some seniors, once they've been here for a while, can start to help, but absolutely. I really think that health equity is our best chance to undo the damage done by racism in America, because when you solve problems for health equity, you solve structural problems, right? When you solve it just for health, let's say, then maybe you're focusing on the unique aspects of the black body, right? There are few, right? But health equity in what's driving the disparities has little to do with that. Most of it is environmental, social, education, access to food, things like that. And so that's why I think it's our best chance, because we packaged in health, right? Solving racism packaged in health. And that's part of why I've committed at least the next few decades to.
So do you have plans to go outside of New Orleans as well?
We have to be $1 billion company.
Yeah.
Can't do
That's
it.
awesome.
We can get up there, but we can't quite get to $1 billion here in the city.
So are you building networks, starting to do that in terms of making those connections?
We're gonna try to make it work here first. I'm from Houston. That'll probably be our natural next stop, or Atlanta. But yeah, I mean, a lot of the incubators that we've been in over the course of the past year have been all over the country, right? We did one at Harvard. We did one that was based in. We went up to Hartford, up the street from Boston, as well. So our brand is getting national recognition. But as of right now, we're just focused right here. Yeah. Do
you find that your networking is coming through like other universities or from like healthcare companies, insurance companies, like?
So I've treated this truly as a startup company, and so most of my network has grown through that lens. Yeah. Right. Less academically. Academic stuff, it doesn't move fast enough. No. Right.
So more in incubator types of.
Yeah. However, the academics are in those spaces.
Sure.
Right, at Harvard, they had these experts in residence who all had some sort of degree from Harvard or a part of some MPH program or doctoral programs related to health, right? So they have these, but they know both worlds.
So it's also always the intellectual property wins.
Yeah.
Because the universities, it's at the University of Belmont.
Yeah, there's so much more red tape, and we're just trying to, as a startup, trying to move fast. Right.
Could you talk a little bit about what your prototyping process was like for this? Like, you talked a lot about customer discovery, but how did you launch the working version or the wireframe, or what was your approach?
Yeah, so again, it was very easy for us, kind of turnkey. Our developers already had the platform essentially established. Last year, we started using ourselves. So myself, our students started using the platform, started gathering insights. How do you feel about it? What do you think of this? How does the health score make you feel? Again, the thing that I started seeing was people checking their blood pressure, and I started seeing people in the gym who weren't in the gym before. So that was interesting. And then actually a year before, for my MPH practicum, I did a pilot with about 50 people and got some insights from that. So we did a little bit of testing there, but to me, you really don't know until it's really out there, to how people are engaging with it. Our official launch, though, was Mardi Gras. this year.
Nice, congrats.
Appreciate
You're
it.
asking people how many alcoholic drinks they drank during Mardi Gras?
I didn't, but next year. So, our vision at bEHR is to, again, seamlessly integrate health into Black culture. We want to place it at the core of how we live, learn, work, play, and celebrate in the Black community.
So you're essentially figuring out how to do the tech transfer piece to get it out there.
Yeah, and again, that part was relatively simple for us because our developers did all the legwork. We have a full team of developers on our tech side that take care of everything, any problem. Oh, yeah. So this year we did the Mardi Gras Steps Challenge. Did anybody hear about the Mardi Gras Steps
No,
Challenge?
that's so cool.
Yeah, so it.
That's so good.
Yeah, and so it was kind of crazy. I'm gonna pull up some stuff on Instagram to show you guys.
What was who was the winner? What was their score? What was the gap between the winner and the second place?
Man.
And did their score improve?
Yeah.
Crazy. It was crazy.
And did you measure it by steps or miles?
I probably walked 30, 40 miles.
Oh my
Did
god.
you? You wouldn't have won. And that's a lot.
Yeah.
Let's see.
I think it's incredible that you've like created such a tool to like give people independence of like knowing what's going on in their bodies.
Mm-hmm. Yeah, I mean, that's what I like to say is that we provide Black people a private, secure, comprehensive tool to evaluate and improve their own health in real time.
Like, I guess, like, I think it's nice too that you're starting, like, centering with that, and then like going from there to the connection with the healthcare professionals, just because like automatically giving that is like what we're already used to having, like for someone else to like solve the problem for us and determine the problem versus like first to start with the app to like learn what's going on inside myself, and to like if you're doing the app it's because I'm choosing like I want to know what I need to know. And then I can go if I need support for a lot of things. It sounds like a lot of things out, and then 90% versus the 10% at the doctor's office is stuff that I might be able to just do
Absolutely.
in the city.
And most people don't know that.
Yeah. So I think
It's
that's
a
amazing.
personal control.
Yeah.
Yeah, it's the locus of
And then it's like, and if I need to go to the doctor, then I can go to the doctor.
Which again relates to you're getting input from actual people as opposed to doing top-down. You're doing bottom-up.
Absolutely.
I think it's nice too, because then if I'm also working with a 90%, like you were talking about earlier around access with healthcare, but like if I'm less depressed, I might finish my Medicare application. Or just like everything.
That is so real.
You know, like, but you know, like I might do some things that I wasn't able to do like a month ago, just based on like mental capacity.
Yeah.
Well, and actually, the fact of having some control probably would be a major factor in that.
Absolutely. All right, let's check out some Mardi Gras Steps Challenge. Okay. So these people took a lot of steps, man. So this is our entire promotion campaign. So whoever took the most steps between February 9th and February 13th wins $5,000.
Wow.
Whoa.
Yeah. And so we did.
Like, that's a really
I would post flyers like all throughout the city. Don't report.
Pass your
guys.
phone to your friend when you're done.
Let's see.
Alright, yo, Commentary here reporting live from London Gras on the Mardi Gras Steps Challenge. These people still stepping. It's slowing down a bit, but they're putting up some real numbers. Alright, so 10th place, Big Stepper. 79,526 steps. 9th place, David Whitfield. 81,188 steps. 8th place, Joel Doucette. 94,265 steps. 7th place, Valiant Cox. 107,836 steps. 6th place, Avery Matthews. 138,807 steps. Kelly Smith, 5th place, 144,000.
There's a comment saying I was one.
I thought that
I was one.
4th place, Justin Lagarde,
Then people started walking across the country.
655 steps.
I mean, if you're in Mardi Gras parades, you need a lot of steps.
3rd
Oh my
place,
god, duh, these people are probably in the parades.
Yeah. I don't know that.
178,873 steps. 2nd place, Shauna Thompson jumped tennis buoy in the ranking. She's at 195,990 steps. And in 1st place, the top stepper, the hot stepper, 258,999 steps in 4 days.
What? What?
What parades do they do?
And who is the hot stepper? That's what everybody want to know.
It's
I'll
you.
report again from Orpheus.
Wait, is it you?
No.
Wait, how many steps is that? 289?
That was Monday, Lundi Gras. He finished with 339,000 steps.
How many miles is that in 4 days?
That's about, so the top 10 walked 700 miles in 5 days.
All together?
Oh wow.
Wow.
That's,
Let me see what this was.
I want to know what cruise they're
I think he did over 150 miles.
But then you were not in the parade.
Wow.
No. So you didn't have to walk at the parade. You could walk anywhere, right? It's just whoever takes the most steps.
Wow.
Yeah. So the Mardi Gras Steps Challenge will always be like that. Whoever takes the most steps. But the rest of our steps challenges throughout the year, which will still be centered around New Orleans culture and festivals, will just be, can you take 10,000 steps a day for the time period? Because it's not healthy to take 300.
Yeah.
But it's exciting and fun, so people we do.
Can we do team walking and start a bracket for next Mardi Gras?
Yeah, we're gonna try to make it a little more inclusive. You know what I'm saying? 'Cause there's some people that's gonna get out here and dominate. I mean, he just really needs the money. He was like literally. So on the first day, he was really strategic about this. Like this man playing this out.
It's like I'm about to get this money.
Did you talk to him?
After the fact, yeah, or like throughout the challenge for sure.
Yeah.
Well, when he crossed 20,000 steps in the first 2 hours because it started at midnight,
Uh,
I was like, okay, hold on. What's going on here for real?
Right.
And anyway, he was just running. So.
wow.
Yeah, he was really dedicated. But what he did was he did like 50,000 steps before anybody woke up. So imagine you're in the challenge.
That's how you win a relay.
You wake up and you're like, I give up. Right? And then he cleared 100,000 in the first day. He said he watched a bunch of videos on YouTube and apparently people had done like 100,000 steps in one day, and so he just wanted to try it.
Oh my god.
Competition thing again.
That's people going, and they're invested, right?
Back on.
Shauna Thompson, 2nd place, had 292,000.
That's kind of she made. I'd rather be like 15 tweets. Right there.
But for the challenge, or no, during the challenge, I did a special run to officially launch there in New Orleans. So,
Oh, nice.
Long run.
I like that you also posted your splits.
So yeah.
That is so cool. Yeah, that is so cool.
You should just get better times. Keep doing that round. Better times.
All right, so I couldn't. Oh yeah, that would be fun.
Yeah.
Yeah. The hardest part was getting from Broad to Claiborne. There's not like a straight shot there. I had to.
To make the.
I learned a lot about that area.
Broad the Greenway?
Zulu.
No. Right by the Superdome.
Oh, I see.
That like goes from Broad, or not Broad.
Yeah, yeah.
It's Poydras. So I was on Broad,
Yeah.
turned right on Poydras, and then trying to turn right on Claiborne. There's no turn.
Right.
Get you more creative.
Yeah. So.
Start going through buildings.
So, get my house for it, maybe I could do that.
That's so cool.
Alright, so how did we do, guys? How are we feeling about our scores?
I actually kept saying there was a problem, so I said.
Okay, so on Apple devices, sometimes there's a problem. It's optimized for desktop. Anybody else had a problem as well? No, you you're good against that before.
I'm gonna try that.
I found some of the questions tricky.
Okay, tell me about it.
Well, for instance, like some of them were yes or no questions, and I feel like there's a lot of shades of gray in it. Like, do you smoke tobacco? I'm not a chain smoker, but I have a puff of something like once a week, you know? So that was that was a hard question for me.
Sure.
So I didn't know if I should lie, or I didn't know if I should, so I said yes, but then I was like, is my score really low because it thinks I'm smoking a pack a day, you know?
Yeah, no, it's a great question. So in the health score assessment on the app is a lot more comprehensive,
Okay.
and it's on the questions that have gray area. There's a sliding scale,
Okay.
right? As opposed to like yes or no. It was hard to do it on that.
Yeah.
I felt that too, and I was just like,
Or
Yes,
sleep,
yes,
like I typically get 8 hours of sleep a night, but I just couldn't sleep last night, and then my baby woke up at 2 a.m. and I go back to sleep, and so I think I maybe got 2 hours of sleep last night. That's really
What's on average though?
Huh?
Whatever. What you
Yeah,
do on
average.
Okay.
Yeah.
I was interested that some of the questions were about feelings, like do you feel good about the amount of exercise you're getting? And I had a moment of reflection. I was like, do I? I don't know.
Yeah, it's interesting.
Yeah.
Turns out there are a lot of psychometric data points that are very predictive of health outcomes. So even as predictive as something like blood pressure, I think there's a question in there: do you feel good about your overall health?
Yeah.
Right. Apparently, that is nearly as predictive as blood pressure with health outcomes.
So people's senses are accurate? Is that right?
I think there's a lot going on there.
Okay.
Senses are accurate, like how you feel, like you pretty close to how you're doing, but also just the attitude, right? It affects health outcomes.
Wow.
You see what I'm saying?
Your control. I like the one about financial, like.
Yes, that's so important.
Yep. Absolutely.
So with that question, for instance, like with the AI coach, if you ranked yourself low, would it start giving you tips about investments and like would it, you know?
Those we can add those. We haven't, but that's
Yeah.
I like that. That could win.
Yeah, just
Yeah.
you know, I'm wondering how. Like,
Because there's some simple investment tips.
that's like something that's just you don't really learn. A lot of people don't learn in school about personal finance and how to, and especially right for Black communities that have not been able to inherit wealth over generations. Like that's yeah.
Have you encountered any like tech literacy issues? Yeah.
Yeah. So, my parents are in their 60s, early 60s. I don't think they're old by any stretch of the imagination, but they act like it when they are trying to use my phone, use the app.
Oh my goodness.
And anyway, so there's that, right? Just tech. I don't know what's the word I'm looking for, guys. Just apprehensive. Whatever it might be. But again, we're a health equity company. If someone doesn't want healthcare delivered through technology, we're not going to deliver it to them through technology.
Yeah.
I have no desire to force this on people. But for a lot of people, this is the best way to get them engaged with their health, and so we use those resources for them. But again, we're going to have healthy grocery delivery, virtual care, primary care clinics, right? Again, a healthcare resource for the Black community, but building it with them. Absolutely. And eventually the tech, the app part will be in the background. So a lot of things can be tracked automatically if you have a wearable device. A lot of people wearing continuous glucose monitors. People will be able to see as soon as they eat something and the effect that has on their blood sugar regularly because they're wearing a continuous monitor that's connected to the app. And so, oh, well, when I ate this, kept eating this, my score was going down consistently. But when I was eating this, it wasn't. But eventually you won't have to necessarily engage with the technology beyond wearing it. And that's really where health is going. That's what precision health is all about. But we're just early in the game. Yep.
When I hear you say this is for the Black community, it makes me think about like the term like Black Lives Matter, and when people have questions like, oh, what about other people? And then it comes down to them being like, I can say Black Lives Matter without it being a negative or like non-inclusive to others. Do you think that Well, do you ever get that kind of question to your training in this, like, because you aren't saying that it's not open to other people, you're just saying this is for the Black community?
Yeah, all the time. I didn't realize how radical it was. Maybe I can check on my brain a little bit, but yeah, we get that question all the time. Whether it's through the lens of like, why are you limiting your market opportunity, right, as a business, and what about everybody else that can benefit from the platform? To your point, we don't limit who can join the app. Right?
It doesn't say like what's your race.
Yeah, no, it will eventually. Yes.
But it sounds like who it's designed for. Like so many other health systems have been designed for white people, right? And like all of your customer discovery is with the Black.
But the very fact of doing that is seen as a radical.
Right.
Yeah, I did not realize it. I just thought it was the most efficient way to solve the problem. That's it. Had nothing to do with that. It's funny. The question of race isn't in the app, and I asked the developers why, and it's now they're a European-based company. They removed it because it doesn't matter. Right? I was like, okay.
Doesn't matter.
It's because they looked at race as just color, right? Right. But your color has nothing to do with like what health outcomes you might be at risk for. I mean, very few, right? However, the color of your skin does affect what you've been exposed to and subjected to and experiencing, and that has a direct impact on your health. And so I've encouraged them to include it back, and our version of the app will ultimately have it regardless.
It's not to say that they don't have the same impact there, right? Like people of color aren't experiencing racialized existences, but they literally say race does not exist in a lot of these places. So,
It's like, what I mean like by its common knowledge in public health is that like racism is a public health issue, and that's like across the board something that's accepted, and like a lot of people are very passionate about it. And if you're not on board with that, you're kind of like pushed out of the field. And so I guess I kind of thought like,
I mean, what, over the past 2 years maybe?
Right, yeah, that's true. That's so true.
I think that, yeah, they just
I've been very fortunate to be around some like very normal people.
Right. The other thing that I respond to that question with is that when you solve problems for the most dispossessed or those who are struggling the most, the impact scales up. Right? If we learn how to help Black people in America become healthy, there will be so many learnings that every other race will be able to benefit from. Because again, impact scales up when you solve at the bottom. When you solve at the top, it's going to miss factors that are affecting and driving health disparities in other communities.
Potentially go into, you had talked about environmental factors. Lower income communities are obviously often impacted by environmental issues. And could that play into what's your exposure?
Absolutely, 100%.